Madam Secretary, thank you for your service. Appreciate a great deal what you're doing. I am concerned about the Children's Health Insurance Program and the question of Medicaid in general. In New Jersey, Medicaid and the Children's Insurance Program, which we call New Jersey Family Care, serves over 800,000 children who would otherwise not have access to regular medical care. And we have seen that number grow by 8% since 2009. Now, I am hearing a series of governors say that they want relief from the requirement for keeping Medicaid enrollment eligibility as is. And that would mean to me, when I hear relief, that to me is translated into cutting eligibility means to cut children, pregnant women, sometimes seniors, none of which feels like a really great way to balance a budget in terms of choices. And it seems to me that people without coverage still get sick, without Medicaid or with lower Medicaid eligibility levels, that the cost of providing these necessary services will shift to hospitals, which is entirely opposite the focus that we try to do in the Affordable Care Act, to get people out of an emergency room as their form of primary care health, and we'll shift it to hospital and clinics that are required to help people in need. And that cost shift doesn't stop there, because hospitals and clinics will have to make up the difference somehow, and they'll charge higher rates to private insurers, and that ultimately means people with insurance will ultimately pay the cost or higher premiums. So I would love to hear from you as to what is your department and this administration's response to this request and the concerns that I have of what it means in terms of a cutting and cost shift to some of the most vulnerable in our society.
Well, Senator, I think we share the concerns that cutting health care for potentially millions of Americans is not a strategy that helps us win the future, if you want to use the President's terminology, that we need a healthy, prosperous nation and a healthy, prosperous workforce, and that we understand the budget struggles states are in, particularly in this window between 2011 and 2014 when there's additional federal help. So what we have done very aggressively is try to work a state at a time to look at the issues and look at the situations and share with them strategies. I mean, you heard Senator Coburn talk about what Rhode Island is doing around a waiver that actually guaranteed that they would not drop eligibility, but used their flexibility to lower costs and enhance quality. That kind of strategy, I think, is available to states and ones that we look forward to working on. You know, the irony, I think, Senator, as you well know, in the Medicaid budget is the largest cost driver of any state is often the dual eligible population who is in nursing homes. That has become an explosive population and frankly kind of shifted onto states. And having some longer term strategies and conversations with governors I think is appropriate, but children are often not only very vulnerable to not having health care, but also very inexpensive. So it's kind of a lose-lose situation. If they're cut off the program, they can be damage for a long period of time, and yet a state basically doesn't save money.
I appreciate that. What I am concerned in is that I hear many of my colleagues who talk about family values. I hear them talk about the sanctity of life. It seems to me that when we have that life brought into the world, that that value doesn't get diminished, actually has a greater societal responsibility. And so I am afraid of where we are headed in that respect, so I appreciate your answer. Finally, Senator Grassley and I have legislation called the SAVE Act, which is about child support. I'm thrilled to see that you're committed to enhancing funding for child support enforcement. Our bill requires a lot better tracking mechanisms through a centralized lien process to ensure that information about child support in one state is available to other states, which from everyone I've talked to, from judges to welfare departments to others who administer this, tell me this is one of the critical challenges they have. And I hope that both Senator Grassley and I can work with you as you are incentivizing states to look at how we incentivize this mechanism for a central lien process that I think will reverberate to the benefit of the taxpayers and most importantly to children who should be getting those support payments.
I look forward to that.
Thank you, Mr. Chairman.